You're listening to the Aesthetically Speaking podcast, presented by Nextech.
Welcome. This is the Nextech podcast, and I'm Robin Ntoh, your host, and I have the pleasure today of actually being live with Greensboro Plastic Surgery and Dr. Collier Pace and his staff. We've brought a team today to visit your practice, and super excited to actually have the opportunity to be away from the trade show floor, be in the practice, actually get to visit with you and be part of your daily operations. So let's tell our listeners a little bit more about you and your practice.
Yeah, well, it's great to have you here. The Nextech platform is an integral part of everything that we do here. So it's great to have you here and to collaborate. We've just turned 2. So we're relatively new, independent plastic surgery practice. And my background, I was previously employed at a private practice and then went the whole other direction and was employed by a hospital system. And I don't know, I think I just wanted to do my own thing and set my own standards, make my own choices. This is what I chose, and so we're off to a good start, and hopefully we'll keep up the early momentum.
It's exciting, though. You and I have had a couple of conversations. Recently, we had an opportunity to catch up at the plastic surgery meeting, and it was exciting to hear that you're actually getting to the next stage where you're growing your provider staff, you're adding more services that augment your business, provide more in that arena. And I think you're actually looking at a scalable way to build your practice. You're not trying to do it all at once. Sometimes I'll visit with physicians and their goals are right now, do it today, must have it all. But you're doing this in a very thoughtful, intentional way. And not that the other surgeons are wrong. I think you have determined that this is the approach that you want in your business. And many of those things that you're choosing go without saying. You've got tenure in this industry because you worked for someone else. You had learnings from that. Now it's the next stage in your business that you want to change about it.
One of the reasons that I didn't start my own practice from the beginning is that I'm fairly risk averse, or at least I think of myself that way. And so it's not in my nature to just, try to blow things out of the water and maybe overcommit. From the very beginning, the thought process has been, what's the next reasonable thing to do? I have kind of taken it one step at a time. A lot of people in business that I've talked to, they'll say, come up with your 5-year, 10-year plan. And I think, certainly that's important. But, it's also important to think, okay, like what's the next incremental step that I can do that's not going to overcommit or distract, that's going to add value and, improve something about the practice. That has just made sense rationally for me as a way to approach growth.
So one of the next arenas is around building your non-surgical business. So you talked about that a little bit. What was the motivation that was the next thing to do within your business? What drove that decision?
Well, a lot of things are driven by the demand of the people that are already coming in. And so, there was a day where I was just up at the front desk, talking to Taylor and Tiffany, and 2 people called wanting to come in for injectable treatments. They said, oh yeah, our next available is, 8 weeks or sometime in the future. And both of them said, oh, sorry, I don't want to wait that long. And so to me, that was a very clear indication that, maybe we should look at increasing our capacity to meet that demand. So that's just one example of a sort of a day in the life insight that says, oh, maybe that's something that we should look at. And then obviously, you look at it in more depth. Who is that person going to be? What do their credentials need to be? How are you going to, as the owner of the practice, assume responsibility for whoever that is, You kind of get into the details, but having an event like that where you can clearly see people going elsewhere because of your limited capacity makes it sort of seem like it might make sense.
Motivation.
Yeah,
Motivation.
that's right.
Well, I think the other thing that we look at from the software side is where does that data actually support those decisions? Because we want data-driven decisions. Of course, the data's got to be in the system, but the fact that your staff could turn to you and say, we're already booked out 8 weeks, that utilization of your schedule and understanding it, it's really key. I don't think a lot of people actually recognize that true value of what is your utilization. And as you build out into the more non-surgical arena with these other providers in your practice, one of those things that I think is key that I see practices starting to think about is, well, what is their utilization? How far out are they booked? Because it's an indicator as to when you might want to consider when does that next provider need to be added to the practice. I love that it was an anecdotal conversation, but for your team, it was also backed by the data.
To give you a sense of the conversations that we had, we actually had a team meeting a few weeks ago, and one of the topics was how much do we need to limit the injectable visits in the future so that we still have enough room to put surgical follow-ups, and so forth in place. And that's the other aspect of it is frequent communication amongst the team brings those things to light and then and further reinforces a decision to add capacity, for example.
Well, the spirit of team within this practice is very evident. And it's one of the things that we were just talking about earlier amongst the Next Tech team is how nice it is to be in a practice and see how comfortable your team is with each other. And you feel that, you see that they're a great team, not only working together, but also caring for your patients. So again, thank you for letting us be here because I find that that's just ideal for us to learn more about this industry from your perspective, but also get to see a real working practice that really does care about not just the patients, but also the staff that are in that practice. But that's also part of where you grow your business too as well. I think another area that we see in plastic surgery practices, and I'll go back and paraphrase this with, we see there's a surgeon that starts his business, and then when they think about growth, an obvious avenue is adding an additional provider to really facilitate on those non-surgical components, provides more opportunity for existing patients to get in sooner, et cetera. But we also think about operating. So office-based surgery, accrediting a facility, thinking about where that is in the future. And we also know that in the industry that block time, which is what gives you that secure time at an ambulatory surgery center or a hospital facility, is starting to become more limited for plastic surgeons. What does that look like for you?
As I think about adding the potential for me to do my own surgeries under my own roof, it offers a lot of potential benefits. The surgery centers and the hospitals, they are a arena where I have limited control. I don't control the staff. I don't control the equipment. I don't control the efficiency between cases. I don't control when I can operate. And in a perfect world, I would have control over those things. And so for me, I think it is a major leap in terms of complexity and investment in the infrastructure of the practice, but it also has a major benefit in terms of efficiency doing cases, but also the quality of the service that you're able to provide. For example, at a surgery center, if the team is different every week because they have turnover of staff or they need certain staff in certain places, if that team has not worked with you before or has never worked in plastic surgery before, there is a lot of reinventing the wheel when it comes to how to set up the equipment, where to put it in the room, what to open, what to have. All these things require brain power of somebody. And in that case, that's me. and you have to, it almost distracts from continuing to make incremental progress. And that's at a, at the point where I am in my career, I'm trying to do things better every time, at least a little bit. And when there's no consistency in the foundation, it's harder to build. If I have my own OR, then the staff is there every time. The equipment is whatever I want it to be. And you get certain processes in place that are automatic. And that makes it a lot easier to then say, okay, what can we do to make it better?
I'm sure this was not an easy decision because it is an investment for you from a business perspective. And it also means that you have to add more team members to your business as you think about that staffing component. When you think about the stage of your business, when you opened your practice 2 years ago, again, congratulations. Did you see this as happening within the next 5 years, 10 years? Is this happening sooner? Where did this fall when you were 2 years ago thinking about how this business would open?
To be honest with you, it's hard to remember.
That's fair.
Because I think at that time I was so focused on just getting the doors open and trying to be, as lean as I could reasonably be. And really with a pretty uncertain view of the future. In terms of envisioning like how the trajectory of the practice was going to transpire when we opened, I really don't remember what I was thinking at the time. I think my main focus was to open, keep expenses as low as possible, and then see who showed up. And things have, I think, honestly transpired a little bit quicker than I would have envisioned. The OR, I probably did not envision building out an OR at this point, or else I probably would have gotten a bigger space.
So if you had to go back to yourself 2 years ago and to your younger self, say, do this differently, would you have done anything differently though?
No. I mean, at each point along the way, I was making the best decision I could with the information that I had. Is it easy to look back and say in retrospect, of course, but did I think I was doing the wrong thing at that time? Absolutely not. It was a safer choice. Yeah. And even the previous jobs that I had before opening my own practice, not a waste of time. I learned a lot of stuff, and I was able to get my get more comfortable as a doctor in those first few years, which I think helped a lot with the quick takeoff of this practice, because doctor-wise, I was more comfortable, more confident, and didn't necessarily have to find my way through that stuff while building a business at the same time.
Well, think of the learnings that you've gained over the past 2 years, that even if you do move to a new space to add on the OR, think about the learnings that you have that you can say, well, now I've learned what I did before, built it this way, had my room set up this way. I know better now that I would probably do it differently. Those learnings are valuable. Not everybody has that opportunity. So I think that you can always look at where the golden ticket is and all of those different opportunities that arise in our lives. But it's exciting to see that you're at this phase just within 2 years. I've been around this industry for a long time, and I see many physicians that don't get that far that quickly. So it says a lot about your business and where you're going. Thinking about software, because we want to go back to that, and we think about how that intersects. One of the things that we've had the opportunity to think about today is AI. That's the topic of everybody's conversation. I think we would be very remiss in not bringing it up. But we've had some deep conversations around where this fits in your world. And one of the things that you're part of right now is, as a KOL for Nextech, you're actually been part of that steer co committee to really think about where's the right place for AI for a plastic surgery practice? Because there's a lot of practices right now that are just thinking about AI as scribe, scribe, scribe. And yes, there is a place for it, but let's talk a little bit more about where do you envision scribe and what it does for you, and what other opportunities do you think you've started to see that AI could play a place within your practice?
Oh, well, I think about it all the time. And I do AI searches telling me or asking what I should be thinking about for AI for my practice. And so it's certainly on my mind. And obviously the scribe is what I would consider low-hanging AI fruit. It is a documenting task that most physicians don't like to do. And so that's an easy one to get behind. And I certainly see the value in it. Other things that I have actively looked for in terms of ways that I think AI could be implemented in a practice, analyzing all the data that's in the medical record system, tracking revenue, tracking patient volume. If there's a way to track patient feedback, all these things are there, but are sometimes hard to compile in a way that gives you, or at least gives you exactly what you want. Okay. There are a lot of front desk related tasks that I feel like are on the cusp of being able to be automated. Like, because I'll sit there and I'll listen to the calls, and it's canceling an appointment, changing appointment. I'll see the voicemails of people calling after hours wanting to change their appointment or cancel their appointment. And I do feel like there's a lot of ways that AI could interface with those people, not only during the day, but after hours, and maybe, take some of the load off of our front staff so they could focus on the people that are here, in the office.
I think that's going to be the true hallmark of a plastic surgery practice of the future, is how do they stand out? And one of those ways is truly going to be how do they interact with their patients? Because that's not necessarily replaced completely with AI. AI has a role there, but you're right. I think those tasks like rescheduling an appointment or managing a patient that wants to cancel, and how do I ensure that they get back on the schedule or do that follow-up? Where does AI have that place? You're absolutely right. I love that you're saying I'm searching AI to tell me what I should be looking for in AI. I think that is a great example of the beauty and the power behind it. But to your point, AI is definitively part of the future of all businesses within healthcare. And the way we think about it in plastic surgery is not that different than general healthcare, except that we are dealing with patients that are self-selecting to have aesthetic procedures done. And so we think about they have a lot of choice in the decision, and that requires a lot more from you, from not just a mental capacity, but also from how you manage those patients from a day-to-day and ensure that they're cared for in a very concierge luxury type of component, because that expectation is there. It's what makes you different and what makes that boutique part of your practice stand out. You had said those small tasks that your staff are doing day to day. If you were to think about where AI as a technology is actually fueling growth, where would you want to see it first, though? Do you want to see it in operations, or do you want to see it in patient-facing tools, or does it matter? Because it all can be impactful. The question is, where do you think it maybe has the biggest impact, or is that still unknown?
Gosh, I think it's hard for me to answer that. And I do, and I have thought about various things that I think AI is ready to do for a practice that would help us, but also be accepted by the patient. I'm not totally sure that patients are ready to call our office and talk to AI. maybe they will become that way. Eventually, I'm sure they will. But I think that they would rather talk to an educated, nice person, if they were to take the time and call. I know for me, I'm working all day. So if I'm going to make a phone call, I have to take time out of my schedule and go outside or go to my office and dial the number. And it seems like it shouldn't be that big a deal, but for me, I have to put it on my list to remember to do it. And I think a lot of our patients are in the same, they're in the same boat. They're working, or they have responsibilities. And so if they're going to call, I think they want to talk to somebody. But it's hard for me to say what's going to be most impactful. I have no idea. But I know that I need to keep an open mind and look at what's either going to help the practice or what patients are interested in or expecting in terms of their global care.
It's fascinating that you talk about scheduling an appointment and would AI do that. And it's getting better. It's fascinating. I recently, something as mundane, had to schedule repair of a refrigerator, water leaking, and I thought, oh boy, I'm gonna call and I'm gonna go through this whole rigmarole of the prompts, et cetera, et cetera. And within 5 minutes, I had the appointment scheduled, all via AI, and a text message was sent to me to confirm that the details were correct. I thought that was really a game changer, because not always do you think that they're getting the right information. And the address that they had collected was wrong, but I was able to correct it. And that was with 2 interactions that were fairly painless. And then a few hours later, I had someone at the front door that was there. So the experience overall was superior, and my expectation was probably lower than what that could have been. But I say that to say, it's getting there.
Yeah.
It is getting there. Question is, I think those experiences like mine that I just indicated was so positive. I think as other things in the industry outside of healthcare get better and are more enriched, the expectation will actually transition to, I would expect the same from my plastic surgeon.
Yeah, I think you're totally right about that. And, we have 2 people that sit at our front desk in our office, and occasionally one of them's out. And, if somebody's out, then that person who's here is checking people in and out, and it's a pretty busy day for them. They're not going to be able to answer the phone every time it rings. They're just not going to be able to. And so if that person carves out 15 minutes to call to change their appointment or schedule their appointment, and they don't get through, then maybe you miss them that day and you have to try again. And so that's just one potential example of trying to increase the various avenues to that a patient can communicate and work within an office. And I have had similar experiences where with like an AI support chatbot, where I'm just texting instead of waiting on hold for 30 minutes or whatever long. I'm texting with an AI, and I give them the number, they look up the case, or you can give them information, and at the very least, they can sometimes point you in the right direction. And then it follows up with me the next day to say, oh, how's that going? Is that still working out okay? And so, I agree with you, and I think with plastic surgery within medicine, the expectations for stuff like that are going to be higher. I think people expect more in terms of the convenience and the sort of the user friendliness of the plastic surgery office.
I would go so far as to say that we'll eventually get to the point where it's good enough, if not superior. But then we think about staff. And I think staff expectations around what they're going to be required to do is going to go further from the mainstream of the same thing every day over and over again. I think they'll be managing more of the exceptions, maybe even unicorns, because there are always exceptions and or unicorns when you think about plastic surgery. Those one-offs that happen many times a day sometimes. But if everything else that's normal, like just a standard cancellation with a reschedule, or sending out a survey, or just managing a survey that's lower than normal, and then there's some sort of interaction that comes from that. Those can become standards that you just have AI manage, and then your team really gets to be highly focused on exceptions, which also I think in a lot of ways is going to become the next wave of how we think about what that hiring profile looks like. Because I think teams are going to have to adapt very quickly to managing all those nuances.
You know, I'm going back to Taylor and Tiffany, who sit at our front desk. They are such bright, engaging, like nice, warm people. And I want that channeled to the patient and not distracted by as few mundane tasks as possible. Right. You know, that's just a very clear, obvious benefit that you can get from delegating easy stuff to the AI.
You know, we've heard recently that there's been a little bit of a slowdown. I think some of it's just seasonality, graduations, end of school year, holidays, you know, Mother's Day, Memorial Day, et cetera. And some of it could just be the state of affairs with all of the political arena upset. Do you think that there are any areas where technology, maybe even specifically AI, will have some impact or change that in the future? Because we know that those things are going to continuously be things that we have to react to, but do we think there is any opportunity for that to change?
I'm not sure on the answer to that. I mean, I keep waiting for the slowdown to happen in this practice, and I haven't felt that. You know, you hear about businesses on a larger scale being able to use data and either flex their pricing or flex their marketing strategies or influence the way they package things to attract certain people at certain times a year. Like I grew up in Central Florida, and I used to go to Disney. We would go at the same time every year in December because it was a slow week, you know, and now they don't have slow weeks anymore, or I don't think they do anyway. So, you know, there used to be empty seats on an airplane, you know, and now there's like never an empty seat on an airplane. So, you know, businesses like that find a way to fill the seats. And whether that happens in plastic surgery, I don't know. I mean, I'm, you know, maybe a little old school in the mindset that you just need to provide a good product. And if you provide a good product and you understand the people that you are serving, then you know the likelihood of a slowdown is going to be a little less. But
no, I think that's a great answer, because if you don't have the slowdown, some people are complaining about it. It's truly a testament to the fact that you're actually doing something right. And there's a lot of those somethings probably right now in your practice that go back to your staff, the way that you run your systems, your processes, people, all of those things really add to that. And so one would argue, where is there need for improvement? But as you continue to think about growth and securing it, I think that you've got the right idea. It's exciting to be able to be part of that and be one of the technologies that supports your business, because we always like to see our practices be very successful. And so kudos to you and what you're doing and where you're going with it.
Oh yeah, well no, we look at things to improve all the time. You know, by no means are we at a point where, you know, we feel like we can just sit around. And so we're constantly looking every day, all the time, at things that we can do better, more efficiently, higher quality. And so that's top of mind for sure.
Well, it's also probably really testament to the fact that you've grown so quickly and you haven't had to slow down. So, well, I think that if I were to zoom out and think about where you have been so instrumental in being a voice for Next Tech as one of those physicians that actually understands not just where you are today, but where you've come from, and you have that vision for the future, I couldn't be more excited about where you are and what you're doing and how you support our technology. So thank you.
Oh, well, we we literally can't do it without you. It's an integral part of, like I said, so many things that we do. And, I'm really excited about the things that are coming down the line with Next-Tech.
Those top secret things, right?
Top secret things, but as I have, met more people on the team and you just have a lot of good people that I think are going to continue to improve the Next-Tech product.
It's not perfect, but it's got tenure.
Yeah.
And we like to take our learnings and reinvest and rethink about things, and we want to listen to our customers. And so we want the right voice that impacts us and builds for the future the right way. So appreciate that. Thank you so much for spending the time with us today. Let's tell our listeners, because those listeners don't have to always be plastic surgeons. They could actually be patients or prospects. Let's tell them where they can find you, your website, and
so Greensboro Plastic Surgery is our practice. GreensboroPlasticSurgery.com is our website. On Instagram, Greensboro Plastic Surgery. So it's all
not hard.
Yeah, it's all pretty easy. But yeah.
Thank you so much.
Oh, no, thank you.
Thanks for listening to Aesthetically Speaking, the podcast where beauty meets business, presented by Next-Tech. Follow and subscribe on Apple, Spotify, YouTube, or wherever you like to listen to podcasts. Links to the resources mentioned on this podcast are available in your show notes. For more information about Next-Tech, visit nexttech.com, or to learn more about TouchMD, go to touchmd.com.